During pregnancy, a woman's immune defenses decrease, which is related to the physiological characteristics of the pregnancy process itself of the child. Therefore, infection can multiply more actively and penetrate the urinary tract. Most often, cystitis during pregnancy affects those women who had already encountered this condition before gestation. Therefore, about 10% of women who have previously had cystitis and are chronic sufferers are at high risk of infection flare-ups during pregnancy. Regarding the treatment of cystitis during pregnancy, we must understand that both ignoring the problem and self-medicating are unacceptable. Why? Because the infection can spread further and may cause premature, complicated labor and health problems. For the baby, this can already manifest in the postnatal period. Regarding treatment in the early stages of pregnancy, medications based on fosfomycin are used. That is the well-known monurol, which is taken as a single dose and allows us to get rid of such an unpleasant disease as cystitis during pregnancy. Cystitis can also occur in women during breastfeeding. And we need to understand that in this case, the medication should be chosen so that it minimally passes to the baby through breast milk. And it should have a high safety profile. Antibiotics can also be used, and most often, these are drugs from the penicillin group. Diet and drinking regimen are also very important. Fruit drinks are very popular as well. Why? Because they have an alkaline reaction and help to fight the infection more quickly. If we talk about home treatment, we must always remember that there should be an adequate urination schedule. No delays in urination should be allowed, and you should drink plenty of fluids. In other words, abundant alkaline drinks are recommended. Under no circumstances should you get chilled or walk barefoot on tile floors, as young mothers sometimes like to do. And it is absolutely necessary to consult a doctor, as we have already mentioned. You can take sitz baths with herbal decoctions. This can be calendula, chamomile, lemon balm, or even centauri. I would like to say more about the drinking regimen, meaning we need to understand that it should be plentiful. It should be alkaline drinks, that is, liquids that have an alkaline reaction. This includes the well-known and beneficial cranberry juice, as well as alkaline mineral waters like Poliana Kwasova and other types such as Borjomi. Regarding the amount of fluid intake, when we say plentiful, we need to understand that we also take into account each person's individual characteristics, their body weight, and the time of year. But in any case, it should not be less than 1.5 to 2.5 liters of fluid. That is, it is advisable to drink every hour at least. About half a liter of fluid per hour. Cystitis is very rarely considered a sign of pregnancy. However, in the early stages of pregnancy, women may notice more frequent urges to urinate and begin to wonder whether such a pleasant surprise as pregnancy has happened in their lives. Can cystitis be a sign of pregnancy? It depends on many different factors. Immediately after conception, as we have already mentioned, the hormonal background changes dramatically and the body undergoes significant restructuring. Because of this, there may be a decrease in the body's defenses and infections can occur. It becomes much easier for them to multiply and enter the urinary tract. However, at the same time, we should also mention that in parallel, the pregnant uterus begins to grow and put pressure on the bladder. As a result, there is also an increase in the urge to urinate. But cystitis should not be considered a sign of pregnancy because the only reliable signs of pregnancy are an increase in chorionic gonadotropin in the mother's blood and the detection of the fetus. According to ultrasound data, in the uterine cavity,